Hi everyone, my name is Gurja Basra and I'm the Manager of Patient Programs, Research and Advocacy at Lymphoma Canada. And as Dr. Savage mentioned in the intro, today we are joined here by Dean and Jennifer, who will be sharing their patient and caregiver stories. So we're so pleased to have you guys join us today, and you guys can get started when you're ready.
Hello, my name is Dean Cousins and this is my wife Jen. We live in Maple Ridge, BC with our daughter Holly. I am a survivor of 2 occurrences of non-Hodgkin's lymphoma. My first experience with cancer occurred in 2009. I noticed a lump on my left groin that I assumed was a hernia from shoveling snow. Now, I don't know anything about hernias, where they happen, how they happen, or what they look like. So I thought I'd better see my doctor. She took one look and said, "Doesn't look like a hernia, it looks like an enlarged lymph node." She sent me for an ultrasound, CT scan, and eventually a biopsy. Thankfully, I had the biopsy done in short order and informed my surgeon that I was booked on a 10-day family Mexican cruise the next week. He told me to go and enjoy myself. He wrote on my documents, "Released in care of wife," as Jen just so happens to be a nurse. We went on the cruise. Jen removed my drain and my stitches 4 days in, and we all managed to have a great time despite not knowing about my health. When we returned, I had a referral to see an oncologist. Not great news. Jen and I went to the appointment where I was told that it was cancerous. I had follicular lymphoma. This is where I need to stress that you need a support person to attend your appointments with you. Once you hear the phrase, "you have cancer," you remember absolutely nothing after that. You think, but it doesn't hurt. Am I going to die? Do I have a will? What about my children? How do I tell people? Etc., etc. This is where your support person is invaluable. Jen was making notes, actively listening, and asking questions. Now, here is where I must tell you that our experience was very unique. As I mentioned, Jen is a nurse, but not just any nurse, an oncology nurse at BC Children's Hospital. What a fantastic person to have in your corner. But at times, I think she knew a little too much, because it was harder on her that after several blood tests, a CT scan, an MRI, and a bone marrow biopsy, that my lymphoma was localized and could be treated with radiation alone. This meant 4 weeks of radiation therapy, 5 days per week at the BC Cancer Center in Vancouver. It was quite a commute from Maple Ridge. When I first arrived at my appointment, I saw a waiting room full of other oncology patients. Some of these people were in wheelchairs and they looked very depressed. I guess they had a right to be. I don't know for sure. But I made a decision right then and there I was not going to be one of them. I had no doubt I would make a full recovery from this. I had full trust in my doctors and the medical system. After all, there's probably no disease in the world that has more backing and research done for it than cancer. They know what the best treatment is for each type. After that day, I walked in for treatment like I owned the place. My head held high. My oncologist told me, "Dean, you're not going to die from this. You're going to die from something else. You have such a positive attitude." I truly believe attitude is more than half the battle. Now, you may have heard that after 5 or 10 years of being in remission, you're good. Not so fast. 11 years later, at the end of January 2020, I was in my office at work and noticed a small pea-sized lump on my left collarbone. I didn't think much of it until it began to grow larger. I mentioned it to Jen and she urged me to get it checked out. I called my radiation oncologist and she saw me within a few days. After more scans, blood work, and 2 more biopsies, it was determined that the cancer had returned in a more aggressive form. This time, it had spread to other areas of my body, so radiation was not an option. I had diffuse large B-cell lymphoma. It was decided that chemotherapy was the best treatment. I was put on a CHOP-R protocol. This meant visits to the BC Cancer Center every 3 weeks for a total of 6 cycles of chemotherapy drugs. My first round of chemo was challenging. as one of the drugs, rituximab, gave me uncontrolled body shaking. Apparently, this is a common side effect, and it was treated with Benadryl and steroids. 4 hours later, I was done. Now, when the drugs take hold of your system, you feel completely wiped out. Some days it was all I could do to get from the bed to the couch and back. That usually lasted for about the first week of each cycle. The next week, I started to feel a little better until the third week, I began to feel okay, only to have my appointment time come up again and the whole process begin all over. During my initial visit to the cancer center, there were lots of volunteers, and they were asking, can I get you anything? A drink, maybe some cookies, a blanket. When it was time for my second round, a little thing called COVID had shut everything down. The volunteers had disappeared, and the doctors and nurses were all wearing hazmat suits. I had some strange side effects I'm told were not common. I experienced partial vocal cord paralysis, which I was told is rare in adults and seen more in children. I lost my voice. I had difficulty breathing. I had fevers which would come and go after each round. Now we have a big armchair in our front room that I call the recovery chair. I would go and lie in that chair until my fevers subsided. I also had to have Jen give me injections to stimulate white blood cell production. It came down to if anything weird was going to happen, it was going to happen to Dean. This, however, did not deter me from my goal of recovery. I still tried to maintain a positive attitude, trust the doctors and the science. Of course, I had all the usual things that come with chemo, where all your hair falls out, and not just the hair on your head, but all of it. I was losing enough hair that Jen and Holly took me out to the garage and shaved me bald. Now, I'm known around my neighborhood as the barbecue guy. During my treatment, however, I could not stand the smell or taste of red meat. We were eating a lot of chicken and veggies. I also appreciate cold beer or a glass of wine on occasion. One evening, Jen opened a bottle of wine in the kitchen. I had to leave the room. Just the smell made me nauseous. I lost close to 30 pounds during my treatment, but then I'm a big guy. I had 30 pounds I could afford to lose. I finally made it through all 6 cycles of chemotherapy, but the treatment is far from a walk in the park. In fact, some days are absolute hell. I had no energy, was nauseous most of the time, and could barely eat anything at all. But it was temporary pain for long-term gain. We are now 3 years since the end of my chemotherapy treatments. I have recovered to the extent that I have 85 to 90% of my strength back, even though I tire a lot sooner than I would like. But my hair has grown back, although it's thinner and it's come back in the wrong color. But I guess we can't blame cancer for that. I'm so thankful for the support of my family and friends, as they were all such an important part of my cancer journey and recovery.
Hello. As you now know, I am Jen Cousins, Dean's wife, and I was his primary caregiver during his cancer treatment. I am here today to share some information based on our journey regarding providing support for a loved one with cancer. As Dean mentioned, our situation is quite unique in that I've been a pediatric oncology nurse for the past 30 years. With Dean's diagnosis, I had to navigate the adult system of oncology and cancer treatment, which I quickly learned was a completely different world. Everything moves at a much slower pace and is definitely less coordinated and organized. As well, Dean's treatment with chemotherapy occurred in the first half of 2020, so we had the chaos of the pandemic to work through as well. The first point I would like to make is that knowledge is power. The time at which I had the biggest worry was awaiting diagnosis. There was such a fear of the unknown, and waiting for scan and biopsy results brought about so much anxiety. I found it difficult not to imagine the worst case scenario. I wanted information because once we knew what we were dealing with, we could get on with treating it. After the diagnosis was made, we did what we could to learn about lymphoma and the treatment options. Meetings with the oncologists and nurse practitioner gave us information to help put a plan in place. Naturally, we did look up some information on the internet, but this is something I caution my own patients' families about. It is definitely tempting to dive in and become immersed in Dr. Google, but more often than not, it causes more worry and fear. It's hard not to compare yourself to others. So two individuals, same age, same diagnosis, may have two totally opposing experiences and outcomes because everybody is different. With regards to chemotherapy, it is very helpful to learn the side effects and techniques to prevent and manage them. So you don't need to learn all the complicated names of the drugs and how they function, but knowing what to expect gives you knowledge to be prepared to deal with it. For example, have a variety of anti-nausea drugs at home in case vomiting does occur. Have the magic mouthwash on hand to help prevent mouth sores. This type of knowledge can help you prepare and gives you some sort of control. The second point I would like to talk about is to try not to let a cancer diagnosis take over your entire life. Now, this is hard. Cancer can be all-consuming, and sometimes you can't think of literally anything else to take your mind off of it. What we learned is that it was important to take advantage of the time when Dean was feeling good. So the evening of his first chemo treatment, we had tickets to a comedy show, which we had purchased several months before. We were initially going to cancel, but decided to see how he felt and then make a decision. Well, we did go, and in fact, we went out for dinner beforehand. It felt like great therapy to laugh after such a stressful day and help lighten the mood. Do things that you can enjoy, as it works as a great distraction and allows you some normalcy. So make date nights. It doesn't have to be an extravagant event, but watching a movie, going for a walk, or participating in a hobby can be a very effective coping strategy. Try to keep a positive attitude and not go to the dark side. As a worrier myself, I was fortunate to have Dean as a partner with his laid-back personality and positive attitude. Being a support person, it is also very important to take care of yourself. Take breaks from each other. I told my managers at work about Dean's diagnosis pretty much from the beginning. I took some time off during the initial workup, but did work part-time through his treatments. Sometimes my colleagues would ask, "Why are you here?" because they knew I had a lot on my plate. Well, I discovered that focusing on other families and patients was an effective distraction and surprisingly took my mind off what was happening at home. Learn what helps you recharge and relax and make a point of doing that daily. I have always been an avid gym goer, but with everything shut down during the pandemic, I took up hiking and other outdoor workouts to help de-stress and focus on something other than cancer. I found this balance very helpful for my own self-care. Another point I would like to share is the importance of taking notes, asking questions, and keeping a record. I am an organized person by nature, and doing all these help make the experience not so overwhelming. During appointments, I took notes on what was being discussed. Dean and I could review the content after to make sure we both understood what was being said. If we had questions, we would write them down and discuss with the oncologist or nurse practitioner over the phone or at the next in-person meeting. It is also helpful to keep a list of medications the patient is on. Dean had some unexpected hospital visits, and it was just so much easier to hand them a list of medications rather than try to remember all of the drugs he was taking. I also found it very helpful to keep a record of blood work, scans, consults, and procedures. Patients have access to all this information in the medical records at BC Cancer Agency. You just have to fill out the authorization form for the release of health records, show your ID, and they will print off whatever personal information you require. I actually made a version of a patient chart during Dean's diagnosis in 2009 and another one in 2020. I had all of his cancer information, tests, and results, along with appointments, phone numbers, and email addresses, all gathered in one place. So if I needed to call someone at the agency or look up what his blood counts were, I had everything at my fingertips. So perhaps this book of papers isn't for everyone, and in fact, it does get heavy to carry around, but it did work for me. It helped me keep things organized, gave me a sense of control, and helped me gain the medical knowledge I wanted regarding Dean's diagnosis and treatment. I wanted to talk a little bit about resources and support. I am someone who is usually independent and fairly self-sufficient. However, with Dean's cancer diagnosis, I learned the benefit of asking for and accepting help. A cancer diagnosis is an unexpected major life event that occurs as we are coping with the stressors of everyday life. So for me, Dean was diagnosed with lymphoma, that is the second time, in January 2020. My father actually passed away 2 days after this diagnosis. My daughter was graduating from high school that year and planning her future education. And the pandemic was on the horizon. I was fortunate to have some very supportive friends, neighbors, and colleagues. People would check in, cook meals, go grocery shopping, mow our lawn, run errands, and just listen. And I'm so grateful and could not have done it without them. Utilize resources at the Cancer Agency, like reading materials, videos, and patient and family counseling. There is a patient care nurse line at the Vancouver Centre where you can talk to a registered nurse, as well as a pharmacy drug information line for questions about medication. We used both of these and found them helpful. I also phoned the physician on call in the middle of the night when Dean was having fevers or concerning chemotherapy side effects. It definitely helps you to know that you are not alone and that there are always resources you can access 24/7. The final point involves the importance of being a patient advocate. Dean did not have the energy or the drive to navigate the healthcare system during his treatment. So as a support person, I learned the importance of speaking up if I had concerns or was unhappy with something. So trust your gut, and sometimes you have to be a squeaky wheel in a complex system to get what you feel you need. So ask to be put on a cancellation list if you are worried that tests are taking too long to book. Ask if there is another outlying hospital or a clinic where scans or blood work can be done. During his diagnoses, Dean had a diagnostic scan at Royal Columbian Hospital and an MRI in Abbotsford because those were the quickest places he could get in. Dean also experienced several unusual and rare side effects of treatment. Some of the treatment drugs needed to be omitted or altered. For example, Dean would become short of breath going up a small flight of stairs in our house. We sensed this was not typical. We voiced our concerns and requested a consult. He ended up getting referred to a respirologist and required a bronchoscopy due to breathing issues with his lungs. As a result, he did not get his last dose of rituximab as they discovered this was the cause of his fevers and shortness of breath. So as a support person, be that advocate and have the patient's back, kind of like a wingman. It will help make their journey through the system as smooth as possible. So to conclude, it goes without saying that a diagnosis of cancer not only affects the patient, but family and friends as well. Being the primary caregiver comes with the added expectations and responsibilities that can be difficult and stressful. The advice I would recommend to be an effective support person is to gain knowledge, promote normalcy, keep a record, utilize resources, and be an advocate.
We made the decision to present our stories together as we know that they are intertwined. Jen and I both portray a story of courage going through my cancer treatment. We also represent a story of support that was needed for each other and for our family. Today we are active, enjoy the outdoors as often as we are able. We go camping, hiking, and love to travel. I have joined a walking group and I now walk 15 to 25 kilometers every week. I still follow up regularly with my oncologist at the Cancer Agency. I have CT scans and blood work to ensure that I'm healthy and cancer-free. Overall, we are now living what most would consider to be a fairly regular life. Lymphoma is not a death sentence. Trust your doctors, adhere to the therapy, maintain a positive attitude, and you will likely see a very favorable outcome. To conclude, I would like to express my heartfelt appreciation to my radiation oncologists, my current oncologist, Dr. Carrie Savage, as well as the doctors, nurses, receptionists, and volunteers at the BC Cancer Centre. They are all the most fantastic, caring people. Thank you.
Thank you, Dean and Jen, for sharing your stories of courage and hope for those watching today. And hopefully the caregivers attending can also relate or appreciate the advice. So now I'd just like to direct the audience to attend the next session, which should be starting in the next few minutes. Thank you.